MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today, folks, it is a Friday, but we're in keeping now with a new theme for our Fridays, and we'll do so for a little longer. We're covering a fascinating medical treatment, one that just astounds many when they first hear of it. It's not your first go-around on this merry-go-round. We've been talking about LDA, a treatment known as low-dose antigen that has, yes, the ability to fix and cure allergies, and I am using the C word, but diseases that you never thought were possible to fix. One group of those diseases are going to be discussed today by our guest. His name is Dr. John Wycoff. He's a clinician and family practice physician in East Lansing, Michigan. He was one of the presenters at the conference that I attended about a month ago in St. Petersburg, Florida, and we're going to be talking about the same subject that he prepared for the group of doctors who were at the conference, and he now brings it to you talking about the use of LDA to correct, to cure, to fix autoimmune diseases. Doesn't seem possible, huh? Certainly nothing in conventional medicine can bill itself as being able to accomplish that. You're going to hear why today. Maybe LDA is the thing to pursue, and we're happy to be able to offer it to you now as we start and launch our treatment and use of the LDA process in our offices. Now, on our course of our discussion with Dr. Wycoff today, you want to call in to ask a question or to make a comment. That number will be 412-825-6262. That's 412-825-6262. LDA and autoimmune diseases, and there are a bunch of them. Now, how is this calendar shaping up? Well, Monday may be the first breath of air that we get, because the schedule has been packed up till now, and it will be packed for the remainder of the month. But on Monday, our original scheduled guest, which we have some difficulty getting him in here, Dr. Alan Greenberg, the medical doctor from Maryland who was first snowed in, lost all of his power. Now we find that Mondays, he can't, his publicist tried to schedule it for a Monday, and she called and said, he doesn't do anything on Monday. He's going to be pushed to the end of the month. That opens it up for us to talk on Monday. Probably whatever's on your mind will work. Maybe try to fill in some of the gaps with this LDA discussion. On Wednesday, the heat returns. By the way, heat in both ways. I think things are really going to heat up around here close to 70 degrees by Wednesday. And so we're going to bring on the heat of another kind, the thermography kind, where we discuss thermographic imaging with the girls from HEAT. I'm talking about Michelle and Bethany, who run that operation out in the South Hills on Fort Couch Road in Bethel Park. They do travel all over the place too. Let's find out how things went in the month of October with National Breast Cancer Awareness Month, and how things are going to move on forward from this point, because the breast protection issue is a year-round issue. And if you missed out, if you're laying back in the weeds saying, I don't want to get those mammograms, boy, you're really intelligent. Intuitively, you know you probably shouldn't do it, but we'll make the case for why you probably, with knowledge and a forethought, should probably avoid that also. That's our group, the HEAT, on the 14th next Wednesday. Then next Friday, LDA Fridays, we're going to do it for a while, going to be fascinated by our guest, Dr. Kathleen Janelle, a naturopathic physician from the state of Washington. Now, up there in the state of Washington, naturopathy takes on a completely different complexion. Bastyr is located. Bastyr is a very famous naturopathic college found in Washington. Naturopaths are on the staff of every hospital in the state, and they perform every function that a medical doctor does perform, except they choose not to use drugs when possible to avoid it. And that's exactly what Dr. Kathleen Janelle has done with her specialty. Her real avocation is the treatment of gastrointestinal disorders. And now she's added another thing to her lexicon, another approach along with all the naturopathic approaches, and that is the use of LDA. If you have any issues from mouth to anus, any GI disorder, dysfunction that you've been living with in a chronic state for, well, could be decades now, you may just want to hear how that can be abruptly, and I mean definitively, ended through the use of LDA, this low-dose antigen treatment. Kathleen Janelle will be our guest next Friday on the 16th. On the 19th, the following Monday, guess what? We're finally going to get him here. Luis Fabregas, an investigative reporter for the Tribune Review, who I've been quoting for 5 to 6 years now because of his investigatory work in the medical realm. He has exposed more stuff going on in this state and this community, and he does himself one better with his new book entitled A Transplant for Katie. Katie Miller, who born and raised in a suburb, well, really just outside of Indiana, PA, in a town called Creekside. How she came to require the need for a liver transplant, how she got that transplant, and the debacle that occurred after that transplant. The parallel story here, I think you've heard me mention it, is things are not well up at the Thomas Starzl Transplant Center, run by Dr. Marcos. Things need to be looked at, and of course Luis Fabregas is going to really shine a spotlight on what might be going wrong up there on the Hill at the University of Pittsburgh Medical Center, things that they don't like to talk about, but of course that's what Luis Fabregas does. Then on the 21st, a new guest, Deborah Lynn Ladd. She calls herself the Queen of Green. She's going to be talking about toxicities and how to rid yourself of them. And then finally, coming up at the end of the month, on the 28th, I think, I'm going to keep my fingers crossed, I think Dr. Alan Greenberg will be our guest at that time, finally discussing heavy metal toxicity and his use of a proprietary blend, a product, an oral product, to do just that. He loves to discuss hair testing, which he believes is the best way to approach this. I have sometimes argued with him. I don't say argued, just posed additional information, which he actually will comment on, because I will bring it up. Alan Greenberg is going to be our guest on the 28th, and that's how the month of November is shaping up. If you've been listening to all this LDA stuff, and you have, because patients have been coming to see me, patients that I've known for years, being treated for other things, they've brought up the LDA issue, and then there's been a flurry of individuals contacting us. Evidently, maybe they're listening to the radio shows too. If you think you want to pursue the issue of LDA, it's really an advisory to you. This isn't a treatment that you can just step up and say, do me, okay? You have to have pretty strenuous and arduous prep to get this very easy intradermal injection, but the prep is what this is all about. It makes LDA successful or it makes it fail, and we have to get into your history very much in depth to make decisions about how that you should prep as you approach the LDA injection day. Anyway, more on that. We'll talk maybe a bit about that on Monday. And if you have an interest, we'll be launching, if we get our product on the 15th, which is next month. The product is good for 30 days, and that's in that time frame. We have a number of patients who are already scheduled to begin the LDA approach. If you think you might be interested, come on in to see us. The preliminary discussion with you will allow you to make a decision as to whether to do it, and then another discussion on how to prepare to do it if you make the decision to move forward will be, I think, appointment number 2. And then finally, to get you actually injected with LDA would be appointment number 3. Remember, LDA injections are every third month. Okay, that's our schedule as I see it. Why don't we take a short break? In the interim, we're going to be talking about LDA today. If there's a guy who ought to know, he's been involved and invested in treatment of all sorts of problems, a family practice doc who really does do treatments that have enhanced his practice, his ability to cure diseases in a way no other format has. That's LDA, folks. We'll be back in a moment with Dr. John Wycoff.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Do you have a mother, sister, or a daughter? I want to tell you about a new way to detect early signs of breast disease, thermography. It's non-invasive, there's no radiation, and it's painless. Thermal imaging offers a safe alternative for women and men in the earlier detection and monitoring of many diseases, namely breast disease. Other reasons to utilize thermography may be physical injuries and chiropractic issues. Your body may be sending you a message. Did you get the memo? HEAT, health-enhancing thermography, can read it. Early detection saves lives. Call us at 855-254-HEAT, 855-254-HEAT, or visit us at heat-images.com, heat-images.com.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on the Friday version of our show, and things on Friday have turned LDA. We've been talking about this unique treatment approach for quite some time. We were bestowed with an honor a week ago. The godfather of LDA was on our show for gracing our airways. Dr. William Butch Schrader spent some time to talk about how it all came about, and he has many disciples who have now spread the word, spread the faith, and continue to gain results in diseases heretofore never treatable with any degree of success. One of those disciples was a gentleman I happened to have met at a recent conference in St. Petersburg, Florida, a gentleman who hails from the state of Michigan, the town of East Lansing, and has had a thriving practice there, a family practice in the city of East Lansing for quite some time. How he moved into the issue of LDA, how he has come to expect it to give him treatment advantages that no other forms of treatment have, is going to be our discussion today. And in particular, a group of diseases, a pesky group of diseases, heretofore not even deemed to have a possible C word associated with them. We're going to find out about autoimmune diseases today and how Dr. John Wycoff treats them. Dr. Wycoff is our guest today. Let's say good morning and welcome aboard. John, thanks for allowing me to invade your morning.
Well, thank you, Dennis. It's a privilege and a pleasure to be with you and your listeners this morning.
Well, I know you are a radio personality in your own right. You have your own show in your region, do you not?
I do every Saturday morning from 9 to 11. I host an interactive show for patients called Health and Wellness Solutions with Dr. John Wycoff. It's heard across the state of Michigan on about 10 different affiliated stations of the Michigan Talk Network, and we have a lot of fun.
Well, then you know how it goes. You can have a lot of fun on the airways, allowing listeners to gain information that heretofore they can't get their hands on Because if you bring your practice to the airways, which I believe you probably would do, they're being exposed to very interesting treatment information that they just can't find anywhere else. Your avocation is that of a family practice physician. You are a graduate of Morningside College in Sioux City. I get that right? Sioux City, Iowa.
That's correct.
And then on to Kirksville College of Osteopathic Medicine, family practice residency, and then set up practice in East Lansing. And been there. How many years have you been practicing in the city of East Lansing, sir?
You know, I've been in the greater Lansing area, a couple different locations since 1988. Hard to believe it's been 25 years.
Well, you know, it is an illustrious career, and I know you take pride in the fact, because you mentioned it in the setting that we were in down in St. Petersburg, but some of the very first words out of your mouth is that you are a clinician first, you're not an academician. Elaborate a bit on that, because I really believe it gets to the essence of a Dr. John Wycoff.
Well, you know, certainly I really see myself as a clinician in the trenches, seeing people day to day, and I'm sensitive to that because I'm in a academic community. I'm part of the Michigan State University faculty, and I have an appointment with Michigan State University, which I'm very proud of. But I see sometimes some of the Michigan State individuals, the doctors there, that are kind of bent towards research and academics, lose sight of what it takes to really listen to a patient, touch a patient, and develop a working list of diagnoses and sort through a problem. And I really think that's the job of that doctor who is a practicing physician. And I'm very proud of the fact that that's really the area that I really felt was my calling, was not so much into research. I do some teaching. I've done some research, but it's never really got me going to the extent of just sitting down, meeting with a patient one-on-one, and trying to sort through their problem or problems and come up with an answer.
Well, my hat's off to you because as a clinician, I mean, that's what you were trained for, not to speak to people, but to treat people and to correct their disorders, to identify what might be wrong, and then come up with unique ways of handling their problems. And as things come and are presented to you, you were able to bend and yield and shape different approaches as different treatment possibilities emerged. With that being said, here you are, set up a practice back in 1988, hang a shingle and calling yourself a family practice physician. So people come to you for everything, okay? And so how is it that your practice moved into the realm of allergic response? Because at some point in your career, a light went off, and you started to see that allergy maybe had to be a field of devotion with respect to a bulk way to handle common problems that people face.
Well, that's exactly right. Early on in my clinical practice, I came to the finding or the realization that my ability to really manage people with chronic disease, problems that have been going on for 6 months, a year, or many years, was very limited. My toolbox was just had a few tools in it, and one of the biggest tools that I had was prescribing a medication. That was really the best tool that I had for chronic illness. So people that had depression or insomnia, irritable bowel syndrome, chronic fatigue, even children with ADD and autism, I really didn't have many ways to address those problems. Now, if it was someone with a strep throat or a fractured ankle or someone having a heart attack, you know, I had great tools, and I was very good at treating those acute problems. You know, I could take care of those. I had a toolbox that could handle those kind of issues. But when it came to those chronic issues, those people that I was seeing more and more of, people with chronic disease, I really felt frustrated. And then I dealt with some personal health issues. I just could not get through some issues that I had with fatigue and some brain fog and such. And lo and behold, you know, whether you believe in divine intervention or fate, a brochure came to my office one day. It said, "Come to Miami and learn about allergies." And I went to Miami and met a doctor from Arkansas, Dr. Harold Hedges, who became very instrumental in helping me understand that there were other ways to treat chronic health problems. And it was through Dr. Hedges and the Pan American Allergy Society that I met Butch Schrader at a convention in Kansas City several years ago, and was introduced to this technique called low-dose allergen immunotherapy, what we call LDA, and was fascinated by it. And I was doing more and more allergy-related treatment and diagnosis in my practice, and I said, this would be another step, something else that I could add on and really take this allergy-related treatment to a new level.
Now, you mentioned that your tools were limited when it came to treating chronic disease, that you were just fantastic, as most doctors would say, when it came to acute disorders. But the chronic realm is, I believe, the bugaboo of American medicine because there are no cures out there. And your tools are no different in that realm than anybody else who has a medical degree if we're going to be using medications. You get maybe some symptom relief, but you never really get to the crux of the problem. You never can expect that you're going to turn around a disease and maybe even possibly use a C word in their future. They pretty much consign to the fact that with chronic disease, you're going to remain with that disease forever. So, yes, that's a great discovery on your part that you were helpless to really help people to get to a point where they didn't have to be treated anymore. You moved into allergy as, like I say, you took a conference down in Miami or in Florida, but as you've moved into the allergy realm, you've been exposed to more treatments than just LDA, haven't you? And now I think it's safe to say that it's probably the #1 allergy treatment on your list. Walk us through your evolution that brings you to the point where you have so much faith and trust in LDA, and why?
Well, you're exactly right. My toolbox now is much bigger, and although I'm very proud of the fact that I'm a board-certified family physician, I really tell my patients, I said I was trained as a family physician, but I've chosen to be a functional medicine practitioner. And what that means to me is that I'm trying to find the root cause of your problem and restore normal function. The body has an innate ability to heal itself and to keep itself healthy if we can take away all the barriers we throw at it day to day. And one of those barriers relates to allergy and the immune system, how the immune system goes haywire. And my first one of my first patients in low-dose allergy was a young lady, a 9-year-old little girl named Erin. Erin had one of the worst cases of eczema that I'd ever seen, covering her face and her arms and her legs. And her parents had heard about low-dose allergy. They had taken this little girl all over the country trying to find a solution. And finally it arrived at the Cleveland Clinic, and they felt that she should be on immunosuppressive drugs. That was all that was left. They had tried everything else. And the parents really felt that wasn't an option they wanted to pursue, and they heard about low-dose allergy. Now, remember, I'm about 1 month into my low-dose allergy practice at this point. Very little experience, not really quite sure how it's going to fit, and this couple and their child want this therapy. We put them through our workup and started the young lady on low-dose allergen immunotherapy. And I said, well, let's come back in 2 months and let's evaluate. Well, we came back in 2 months, and before I walked into the appointment, I see Erin running up and down the hallway in my office, and she's a precocious little thing, cute as a button, and her eczema's back. It's as bad as it was the first time I saw her. And I go, no, you get that sinking feeling as you're opening the door. This is going to be a challenging visit with the parents. They're not going to be happy with the results that they came to see. And I walk in, and they both had this big smile on their face. And so, Dr. Wycoff, we're so happy we're back. You won't believe what happened. Erin's eczema completely cleared for 3 weeks after that first LDA injection. It was gone. She hadn't had 3 weeks clear in 3 years. And you told us it would probably come back, and it did. So we're real eager to get that second shot and see if it continues to cause improvement. So it didn't take much for the little light to go on in my brain at that point. Say there really is something to this. Well, we continued to treat Erin, and by the time we got her to a year, her eczema had cleared all the time. She had one little flake left on her upper lip, which I've not been able to get rid of. Just one little flake of eczema left. Otherwise, she's completely clear, and she's been clear now for almost 4 years. And it's really been a testament to her parents to bring her to see us and really become our poster patient for low-dose allergen immunotherapy, because it turned off that immune response that was driving her skin issues. Very interesting to see. It was very powerful. And as I said, things happen for reasons, and I believe that Erin came to see us from me professionally to be able to really begin to believe that LDA could be a treatment for so many people.
Well, that's a great one to have right out of the chute, wasn't it? You called it your poster child, and I can see why that was. And that realm, I mean, the dermatological responses to that provoke allergies, or let me be better said, the allergic responses that lead to skin disorders, is a realm that I think most listeners would buy into. They would look at something like eczema as possibly an allergy. What about all of the upper respiratory displays that allergy can manifest itself? When you're talking about all chronic sinusitis and allergic rhinitis and what else? Conjunctivitis, nasal polyps, asthma. These are all within the realm of thinking by the public that there could be an allergic mechanism at play. So with respect to those diseases, let's call those the commonly associated allergy diseases. You've done pretty well with those, have you not? And the public,
we see great results with low-dose allergy immunotherapy, and from something as simple as just seasonal hay fever that we get a lot of it in the Midwest here with from mid-August to mid-October. When ragweed season goes up, low-dose allergy immunotherapy can be as simple as getting just one injection once a year, and that can really blunt that response for those 8 or 10 weeks of allergen exposure. I do think that people that have chronic rhinitis, chronic runny nose, recurrent sinus infections, kids that have recurrent ear infections, certainly anyone with nasal polyps and asthma deserves an allergy workup. They need to be seen by a physician, whether it's a primary care doctor who at least understands allergy, and most don't. I mean, I have to admit, when I was trained, allergy was really not something that was ever emphasized to me. It was kind of thought to be, kind of a voodoo science, and it's kind of given lip service, and you gave people antihistamines. That's really what I learned in medical school. So oftentimes it involves seeing someone who at least understands allergy-related illness, maybe an allergist, at least getting some testing to determine if you do have an allergen that could be driving those chronic ear, nose, and throat type symptoms you refer to.
Now, you mentioned the magic word because an allergist would be the one that most individuals would seem to think, well, you know what, I need to see an allergist because with my particular problem, this is the specialty that by very, very, very training that they have would be the people that I'd expect to get the most help from. Speak to that point a moment because most allergists, their treatment is much different than an LDA. How do you stack up? How do you explain, by the way, to someone who may be going to an allergist and getting some temporary relief, because I think the word temporary probably is what emphasis you want to make, and how it is that John Wycoff, a family practitioner, would be a better choice with his LDA, an immunological approach, than the standard allergy treatments. Could you spend a moment on that with us?
No, sure. I think allergists do have a lot to offer, especially in the field of diagnosis. They can do skin testing, which has some validity. They can do blood testing, and they can at least open the door that patients have allergy mediating part of their health problems. Now, unfortunately, their treatment, though, tends to be one of standard immunotherapy injections, where you go into the allergist, and probably many of your listeners have done this. They've gone in every week or twice a week, and they get a shot in their arm, and they wait in the office for 20 or 30 minutes to make sure they don't have a reaction, and they leave. And typically the extractions increase in strength over time, and about 2/3 of those people will see relief of their symptoms while they're getting the injections. And really what they're trying to do is build tolerance, so you can actually have exposure to that allergen, whether it's cat dander or dog dander or ragweed or trees, mold, whatever it is, and not react. And that's how standard immunotherapy works. And it does work relatively well, about 2/3 of the time. The problem being is that people do have adverse reactions to standard immunotherapy. There are even deaths reported. There's been about 100 deaths in the last 50 years from allergy shots in the United States. And actually in Great Britain, standard immunotherapy is banned because of the risks that they felt were just too great to allow it to happen in a primary care office, so you can't get that. And it really doesn't give you a cure. Low-dose allergy immunotherapy is the only treatment that is available that can actually turn off the allergic response, and it can turn it off permanently by the effect on the T cells, the cells that actually mediate allergy. And about 50% of our patients, after 2 years, will find that they never require another allergy injection for the rest of their life. Their allergies are, in essence, cured. They've gone away. They never will return. About 50% of the people will find that they can't go forever without a shot. They may have to come in once or twice a year, get a little booster shot, give those T cells a little boost to remain symptom-free. But that's typically a very small price to pay for a type of therapy that can be so life-changing.
Yeah, evidently. I mean, the C word is as far out as 2 years. You have some people that never require injections again. And so the approach to this treatment with LDA, what is so different about it? Describe, I guess, the best question I can ask is, what is LDA? From your perspective, because your patients ask you this all the time, my patients are now asking me. I always love to hear each clinician describe it in their own words. What do you tell someone whenever they ask you, Dr. Wycoff, what is LDA?
Well, you can break it down certainly in the acronym low-dose allergen. It's where we're taking a number, 300 to 400 different allergens. An allergen is something that provokes a response for your listeners. That could be ragweed, tree pollen, weed pollen, grass pollen, dog dander, dust mites, etc. And there are literally hundreds of these along with foods. And we have a mixture of a very low dose, a very dilute, actually a homeopathic dose of these antigen mixes. And they're potentiated by an enzyme. And the real secret of LDA is an enzyme called beta-glucuronidase. And as many great discoveries, this beta-glucuronidase was discovered by sheer accident by some clinicians in England years ago. And they thought that they were going down one path and ended up going down another path, and beta-glucuronidase, which was really a contaminant in an injection that was being used, turned out to be the magic ingredient that potentiated the LDA antigens and provoked a response that turned off the allergic mechanism. The effect occurs in the dermis of the skin. There are some little cells in the dermis, so the shot's given much like a tuberculin test into the inner aspect of the forearm, just a little teeny needle, very, very small amount of a serum is injected, and that effect on the dendritic cells produces a change in the T cells. T cells are our immune modulators, our cells that control those mediators that cause allergic symptoms like histamine and the like, and it actually shuts off that response. So it effectively does result in a cure by turning off that allergic response.
Now, you mentioned T cells. Probably should take a moment to talk about this use of LDA does move into the cellular immunity system as opposed to the conventional allergy treatments that remain in the antibody response system. Could you make a distinction between the two? Because therein lies the real difference between one treatment and the other.
Well, that's exactly right. They're both an injectable type of therapy, but how they work is different. By producing blocking antibodies, and as conventional immunotherapy does, and raising the ability to have exposure, you will reduce symptoms. And don't get me wrong, I'm not going to tell that the allergists are not doing a good job to your listeners, because they do a good job for about 2/3 of the people that see them. They will see relief as long as they continue to get those weekly injections. The downside is about 1/3 of the patients won't see the relief they're expecting. That's a fairly significant amount. And also, a good share of them, once they stop the allergy immunotherapy, their symptoms will come back. And I'm sure many of our listeners can appreciate this. They probably remember going to the allergist every week when they were a child, getting a shot for their seasonal rhinitis, and their symptoms improved. But as they went into college and maybe moved around the country, they stopped their shots, and indeed their symptoms came back. LDA, by working on cellular immunity, affecting the T cells, the cells that affect and actually mediate allergy, can turn off that allergic response. This is what makes it such a unique type of therapy and so effective long term. And also why we only have to give the allergy injections every 2 to 3 months. We don't have to have people coming back every week to get a shot. The T cells live for about 90 days. So we can affect a change in them over time by just giving a small shot initially every 2 months. That's a marked difference in frequency of administration.
Yes, it's every 2-month injection, quite unique, because the cells live for that long. They live like 90 days compared to antibodies that literally only hang around with for a week or so, right?
That's exactly right. The antibodies are going to come and they're going to go, but the T cells have about a 90-day lifespan in general, and we're changing them over time. And so LDA will build on itself. So we see the effect increasing with the second injection, the third injection, the fourth injection. And it seems to level out about at injection 5 or 6. Usually at about the 1-year mark, we're really seeing the maximal effect of the LDA injections, and we're seeing that effect now begin to be maintained longer and longer.
Now, just in keeping with you said, which you said just now about how people respond, and you had that just magnificent response with the first little girl you ever treated. I mean, you do call her your poster child, and I can see why, because you had such a major impact on a skin condition that there was no other treatment to helping that little girl. But as the numbers have now passed, and now you have hundreds and maybe even thousands of patients that you treated, how do you see this thing shake out on a percentage basis? How quickly do you see responses? Is it always, or should you expect to see something happen after your first injection and within a few weeks? And then if not, then what length of time may go on before you begin to see this injection, before you would know, well, this is the treatment for me, or maybe it isn't?
We have a couple different options in our evaluation of patients, and it's determining the correct antigen mix. And there's just a handful of mixes available. But we have to make a choice which type of mix we use. And sometimes we choose really well, and we'll see some response almost immediately. I would say half of our patients on their first shot, first injection, are seeing some improvement for a short period of time. The other half may not. And I always give patients 3 injections before I really make a decision. I tell them this is not a quick fix for their problem. It is going to take a little bit of time to see the result. Now, if we get the result immediately, we know we're on the right track. If we don't by that 3rd shot, then we go back, revisit the history, and change the antigen mix. I would say overall, by the time we get through 3 to 4 injections, 80% of our patients are seeing significant improvement. By the time we get to a year, about 85% of them are seeing marked improvement. Now, we have some people that don't respond. We have, just like with any therapy, about 15% of people just do not seem to respond to LDA. And after that 3 or 4 month mark, if we're not seeing improvement, we reevaluate. Maybe they have a non-allergic cause of their rhinitis or their allergy symptoms. And I think with any therapy, there's always some patients it just does not work for. But when we look at our success rate versus conventional immunotherapy at about 66%, we're running 80-85%, fairly significant better odds, let's say, of seeing some improvement with low-dose allergen immunotherapy versus conventional immunotherapy.
Wonderful results, doctor. Just wonderful results. Your patients, I'm sure, comment in the same way, whether they had immunotherapies before they met you or had no therapies at all. The fact that high of a number, 85%, after about a year, you say you're pretty much on board for around a year to get those kind of results, but hey, that's only 1 injection every 2 months. We're talking about 6 injections in a year. Doesn't seem like much of a price to pay, right?
Well, I think that's right, and people are happy with that. Now, LDA does involve some work by our patients. We have certain rules that they have to follow around the time they get each injection. We call the 3 critical days: the day before, the day of, the day after each injection. There are some dietary rules. There are some things, medications they can take, some they cannot take, and so we have to have our patients buy in. I've got about a 35, 40-page booklet that they have to read and understand and follow, and so there's some participation and some effort by the patient that has to go into making LDA successful. But if they follow the rules, we get them on the right antigen mix, the results can be stunning.
All right. I want to switch our attention for a moment because we've been talking about what I believe our listeners could identify as the common allergic responses, the upper respiratory responses, and all of the expressions that can mean. The skin responses, I think that's not a stretch for them. But then there are a group of diseases, that list of 66 diseases that you and I are both so familiar with, now ventures off into areas heretofore never even rumored to be associated with allergic response. This appears to be absolutely mind-bending to think that things like autoimmune diseases and gastrointestinal diseases have an allergic basis for why they manifest themselves. And so could we spend some time now talking about those odd forms of allergic response that our listener would make the association with, and this group of diseases that you're so familiar with called autoimmune?
Well, those diseases are rapidly gaining strength in this country. We're seeing more and more of these diseases where our body produces an antibody against self. And for our listeners' sake, we know most of us can understand we have an immune system. And the immune system's there to protect us. So if an invader, let's say a bacteria or a virus, enters our body, our immune system jumps at it and like a little army and kind of destroys that bacteria or virus, and so we stay healthy. And that's the way the immune system should work, making antibodies against an invader, a foreign substance. In an autoimmune disease, our body produces an antibody against itself. That's an abnormal reaction of the immune system. So we can have antibodies against our thyroid gland. We call that Hashimoto's thyroiditis or Graves' disease. And we can have an antibody against our skin or our joints, sometimes called systemic lupus erythematosus. And as you said, there are just dozens of these autoimmune diseases, Crohn's disease and ulcerative colitis and Sjögren's syndrome and scleroderma, and the list goes on and on and on. And where our body makes an antibody, we can measure these. We can do a blood test and we can see these antibodies that should never be there. In someone who does not have an autoimmune disease, they're not going to have antibodies against their thyroid or antibodies against their joints. It's just not going to be there. But for some reason in people with autoimmune disease, something gets triggered and they produce these autoantibodies. And, you know, we've been looking for answers as to what causes this. Well, most of us in the world of functional medicine tend to believe that autoimmune diseases are triggered by something, that there's a genetic predisposition to the disease, so there may be a genetic component, but the genetic component does not cause the expression of the illness. There must be some exposure to something else. That exposure could be a food, like gluten or milk, dairy, or maybe an infection. And we know that a lot of gastrointestinal bacteria tend to evoke an immune-type reaction. And we've measured different antibodies to these bacteria in people with chronic autoimmune diseases like rheumatoid arthritis and lupus and the like. So some interesting research has gone into the idea that, if you could block this bacterial response, could you change the course of the illness? So using the same idea that we use with LDA, with pollens and with foods, some cutting-edge people have looked at, can we take a very dilute bacterial antigen, a bacteria such as Bacteroides or Proteus, those are common gastrointestinal bacteria, and mix that with beta-glucuronidase, our enzyme that potentiates this, and cause that immune response, the same response that we see on the T cells, to turn off, and thereby put this autoimmune disease into a quiescent mode, or maybe even that C word we talked about, that cure mode. And indeed, with many autoimmune diseases, we can implement LDA with a very specific type of antigen therapy. This is different than the antigen therapy that we use for our food or our inhaled allergies. We have a different set of antigen mixes, our bacterial antigens. And can we turn this disease into, put it on a different path? And that's where we use low-dose allergen immunotherapy so successfully in our patients with some of these crippling autoimmune diseases.
Interesting that you mentioned, when asked about autoimmune diseases, you start talking about gut issues, about infectious agents within the gut and things going on in the gut. That connection to the gut is just uncanny to me, how the gut plays a role. It's so many things, and I think our conventional training moves outside that realm, doesn't hook up the gut with so many of the other problems that we see medically. I guess also, too, whenever steroids, because everything that you named in the way of a autoimmune disorder, steroids appears to have been the tool that you were trained to use and that I was trained to use to get people through the exacerbations. And it should have been the tip-off that the immune system was playing the role back then, because we wanted to suppress it so badly with autoimmune disease. Now, if you can deal with the immune system sort of on a permanent basis, it should come as no surprise that maybe LDA would play an important role here. And in fact, that's what your work is now leading to, correct?
That's exactly right. I mean, steroids stabilize that immune response, and they will block the expression of the problem, but it's only temporary. And the downside to steroids is that they have a gazillion side effects, and very significant side effects, causing cataracts and causing people to gain weight and suppressing adrenal gland function and weakening joints and bones. So they are not medications that typically can be used long-term without having a side effect much worse than the disease. So what we're able to do with LDA is we can begin to maybe turn off that immune response and actually get to the point where the disease is not progressing. We can turn off those antibodies that are being expressed against a joint in someone with rheumatoid arthritis. We can turn off the antibodies that are causing diarrhea and cramping in someone with Crohn's disease, and we can halt the progression of the disease. That's where it's so exciting.
Now, a term, and Dr. Schrader mentioned it last week when I asked him about autoimmune and things of this nature, and I know that I'd love to hear your explanation. There's something called this molecular mimicry, which seems to be the key issue when it comes to how it can be that there can be associations between allergic responses and bacterial infections.
You're exactly right. This is really what we feel, or how we feel, that LDA for autoimmune diseases work, that there is this molecular mimicry, that different bacterial antigens can be look and appear similar to the body and can provoke a response that can allow us to turn off those T cells. That's really the basis of molecular mimicry. They look alike. So we can take something like Bacteroides or Proteus or Klebsiella, potentiate it with beta-glucuronidase, and get to the effect that we can turn off that immune response at the T cell level and thus keep the patient from having progression of their illness.
Now, you had mentioned that the prep here, I mean, there's that famous 3 days, the day before, the day of, the day after, where special dieting is needed. And when these more complex cases, even much more care needs to be exercised with respect to how you prepare somebody. Explain in brief how this preparation, and really everything hinges on it. If you don't prep right, you're going to fail with LDA. And so to the listener listening to us right now, they play a role in making certain that they do exactly what they're told, and they, I think you used the word, follow the rules.
The rules are pretty much set in stone. I think that, as we heard at the conference in St. Petersburg, there could be some difference of opinion amongst clinicians using LDA. As you said, I clearly am a disciple of Dr. Schrader, and I believe that he is really the leading person in this country who has been doing LDA clearly the longest and the most exposure and experience with it, and who taught me and really just drilled into me the importance of following the rules. As you saw at the meeting, he's steadfast in his belief that the LDA therapy works best when the rules are followed. Now, that being said, apparently some people have patients who don't always follow the rules, and they get good results. The problem I always have is that people are investing a lot of time and effort and money into this therapy. I want them to be successful. So if having them follow certain rules for a few days is going to increase their chances of success, I think that's a pretty good investment, and that's really what I try to impress upon my patients. But the rules can be difficult. We do have an elimination diet, a very low allergen diet. It's really composed of fish, lamb, and potatoes, carrots, water for about 3 days, the day before, the day of, the day after the injection. There are certain medications which we know turn off LDA, things like asthma inhalers, antibiotics, some antibiotics, antihistamines, some antidepressants, some beta blockers. So there are some people that have certain medical conditions. They may not be a good candidate for low-dose allergen immunotherapy. As part of when they come to see us, we're sorting that out. Are we able to get them to the point where they really can receive LDA safely and effectively with their current medical issues? And for autoimmune patients, they actually do need to take a antibiotic prescription for about a week before each injection. So there are some rules, and they have to really be in tune with the rules, and it involves getting my staff educated so they can answer questions, having the patients have a resource that they can refer to. That's our LDA patient instruction booklet, and have them really understand that this is a co-participation type therapy. We need them to participate and to have their buy-in and cooperation if they really want to maximize their chance of success.
Now, in this issue of autoimmune, which we were sort of limiting our discussion today, although we've covered the whole seascape, the percentage of response, here's a group of conditions that there is no real treatment that works at all, unless you're going to use steroids, which just shut this whole thing down as a description for a treatment that works. Yeah, it'll get you through the exacerbation period, but you're right back to square one when it's all over. And how successful, or what could you tell our listeners in terms of these autoimmune diseases? Are we still talking about 85% response rates?
Well, it's a great question. I would say that patients with autoimmune diseases are more complicated patients, and oftentimes autoimmune diseases, and I tell people this, is like a fire burning inside of you, and that fire is going to spread. So oftentimes it can involve several different organs at one time. We can have an autoimmune disease like systemic lupus that can affect the skin, it can affect the brain, it can affect the kidneys, it can affect the heart. Same way with rheumatoid arthritis. It can affect the joints, it can affect the lung, it can affect the heart or the brain. So to say that someone can come to us with an autoimmune disease that's been present for a long time, and I'm going to reverse that to the point where they were before the autoimmune illness started, would be an oversell. We just can't do that. So someone may come to me and have cardiac involvement or kidney involvement on a list of medications. They may need to stay on those medications. But what we can do is we can slow the progression or turn off the progression of the disease. And that's really where LDA can be part of their treatment program. These patients are typically more complicated than our patients who just have simple ragweed allergy. No doubt about it. They've got other issues. They've got internal organ involvement. But this is clearly an exciting therapy that I think if the earlier on in the course of these illnesses we could use low-dose allergen immunotherapy, the better off we can be in terms of long-term prognosis. We're seeing great results in many of our patients. There again, to say that all of our patients respond, that would be an oversell. That's just not the case. But a significant number do see improvement. Their disease does not progress or progresses much slower. The quality of their life improves.
So they're responding. It's just they may have damage to tissue structures, heart, kidneys, and things like that. You can't reverse that damage, but you more than likely should be able to arrest the further progression of the disease. Is that a fair statement?
I would say there again, probably in 80% of the patients, we can achieve that goal. We can slow the progression of the disease, and depending where it's at. Now, as word's getting out, we're getting people coming in earlier and earlier in the course of their autoimmune cascade, and oftentimes we're excited down to see what effect we have if we can get someone who is really just got one, maybe they've just got skin involvement of their lupus. Great opportunity to see, can we impact that? Because we can see the change, just like with Erin with her eczema. We can see that in their skin, and we can measure it in their test. We can look at that antibody response. Are we reducing the antibody titers? So we're pretty excited about LDA and autoimmune disease, and a lot of new antigen mixes are being developed. Things even like Guillain-Barré, there's thought that there may be an antigen mix that can help in the treatment of Guillain-Barré. That can be a very devastating illness for patients. So I think it's an exciting time for autoimmune disease and low-dose allergen immunotherapy as we look to the future.
Now, you brought out your first poster child patient, a little girl with eczema. And in the autoimmune category, do you have sort of a poster child patient in mind, one from the vault there, one that you've had a major impact on? Could you describe how one case went so well for you?
Sure.
I think I'd let our listeners identify with it.
Easy to do. I had a lady who was in her mid-40s with rheumatoid arthritis. She had crippling joint disease damage, already to the point where her hands and her feet had some permanent deformities. She was on a number of medications, autoimmune, immunosuppressive type medications, things like methotrexate and Plaquenil, and medications that can be effective, but have some side effects. She was having some visual problems with the Plaquenil, and it's affecting her vision, and they were concerned about her long-term, whether she was going to lose a lot of her eyesight. And, it's a 45-year-old young lady, certainly got a lot of healthy years left, still having pain. Joints were red and swollen and clearly inflamed. We put her through our functional medicine approach. Now, part of our approach with the LD patients, we're looking at their diet, and looking at their gut health and their the vitamins and nutrients that they're taking, and we're trying to optimize those, optimize her hormonal balance, thyroid function, but implemented LDA, and the results were just amazing. Her joint swelling immediately started to go down, more so than she had experienced with her conventional medications. She was able to get off of her medications, methotrexate and Plaquenil, and her visual changes have stabilized. We're not able to reverse that, but it doesn't look like she's losing vision like she was as a side effect of her medication before. So she's about 3 years into our program, doing well. Now, her joints still have deformity, and the erosions, the damage to those joints is permanent, but her pain is much better. The disease does not seem to be progressing, and the quality of her life is so much better.
Yeah, certainly with architectural deformities that occur in rheumatoid arthritis, you can't be expected to have that turn around, but the quality of her life has been absolutely extended beyond her wildest expectations through your treatment. And I hope our listeners really picked up on the miraculous possibility when it comes to LDA. Now, Dr. Wycoff, we have what we call bongos going off in the background. What that means is we've come to the end of our hour. I wish we had multiple hours more. You have been a fascinating guest. I think bring a positive message to people with serious conditions to go search elsewhere. You don't have to be consigned to the toolbox that you and I were both trained to use. There are other toolboxes out there. You've learned to use them, and they've served you well, have they not, Doc?
That's exactly right. And I tell people with chronic disease, keep asking questions, keep reading, keep looking. We have this wonderful tool called the Internet. We have great organizations like the American Academy of Environmental Medicine, where we were both at in St. Petersburg, the Institute of Functional Medicine, the Pan American Allergy Society. They all have websites. You can search them on Google. Most of them have physician locators. You can find a physician within a regional, a geographic proximity to where you're at. Maybe you do need to find a different approach. Find someone who embraces functional medicine. There are a lot of us out there. It's a rapidly growing specialty. Many conventional doctors, like me, who came from the conventional world, are seeing that our toolbox is too small. We're learning that we can make our toolbox bigger. We can help people with chronic disease take charge of their lives and improve their health and wellness. Maybe we can do it naturally.
Wonderful. Thank you so much, Doctor. There you have it, folks. LDA for, well, all things that may be ailing you, bothering you. Thank you much, Doctor. We're going to say so long now. I want to say stay tuned to us. We'll see you on Monday morning. We'll talk more about LDA then. Until then, this is Dr. Dennis Courtney with Dr. John Wycoff saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.